we are experiencing the lowest case numbers in 20 months, with an average of about 500 cases per day. I would like to contrast that with here in the United States. Yesterday, we had 120,000 new cases, and the United States is only 3 times the size of the Philippines. Next slide, please. What is also striking is that we are also experiencing the lowest hospitalization numbers in 20 months. Earlier today, Makati Med announced for the first time during the pandemic, they have no COVID-19 patients in their hospital. And this is typical of many hospitals throughout our beloved country. Next slide, please. But this is also interesting because we are experiencing the highest mobility in 20 months. So this is a graph from Apple Mobility, and the higher the curves, the more people are moving around. And what you can see, this is the mobility trends from the NCR. What you can see is that many of our people are moving around now the most in 20 months since the beginning of the pandemic and the lockdown in March of 2020. Next slide, please. And so as a biologist, this is the question. We are currently with Delta, the most infectious variant in the past 20 months, the highest mobility levels in the past 20 months. More and more of our kababayans are moving around. And yet, we are experiencing the lowest levels of cases and hospitalizations in 20 months. And so what these three mean together is that it suggests that we have attained substantial population immunity from natural infections and vaccinations in the urban areas of the Philippines. Because the pandemic has raged and spread primarily in our cities and in our first-class municipalities. And so the fact that the virus is struggling to find new Filipinos to infect suggests that we have attained substantial population immunity. Next slide, please. This is to compare the Philippines with 3 of our ASEAN neighbors. So if you look, the lowest graph is the Philippines, and we are at 500 cases per day. You can see Thailand and Malaysia had the Delta surge earlier than we did, but their surge has not been able to crash. So at this time, Thailand and Malaysia are still experiencing 5,000 cases per day. Now, contrast that with Vietnam. Vietnam also had a Delta peak. Unfortunately, the Delta peak has resurged, and Vietnam is still experiencing some significant numbers of COVID-19, 15,000 or so per day. Now, the reason why these 4 different countries have experienced different pandemic curves is probably because, as you can see, the Philippines experienced, unlike these 3 other countries, substantial waves of previous variants. So especially the Alpha Beta variant, which struck our beloved country in March and April of this year. And so combining the vaccinations and the natural immunity, what you're seeing here is that many of our cities where the pandemic tends to focus are now stable enough to prevent transmission. Next slide, please. I just wanted to highlight this graph from the Financial Times, which illustrates the population immunity in different countries in Europe. On the left-hand side, you have Spain, which has about 90% of eligible population vaccinated. And the NCR and many of our urban cities have very similar vaccination levels. And what you can see on the left-hand side, if you focus on the red curve is the number of deaths. And what you can see is that the higher the population that is protected, the smaller the red curve. And across Europe, what you will notice is as the vaccination levels drop, the red curve begins to explode because the current wave that is flowing through Europe, which is Delta-driven, is still quite significant. At this time, given our significantly high numbers of vaccination, not only in the NCR, but in many of our cities. Secretary Vince just sent me the numbers for our cities and our first-class municipalities, and many of them are quite significant, above 70% for the first dose at least. What we're seeing here is that at least the NCR, with nearly 100% protection of the adults and with increasing numbers of our teenagers, is probably going to be robustly protected against the future surge.